Medical professionals. What are the most common things that freak people out about their bodies that are completely normal? A woman came into the ER one time saying something was falling out of her punani. The doctor did a pelvic exam, the whole deal. Turns out she was just so fat she hadn't seen her area in a long time. It was her freaking labia. I have patients who develop a rash, look it up on WebMD, and come to me screaming that they must have Stevens-Johnson syndrome. Most common diagnosis, contact dermatitis from laundry soap. Professional tip, don't search it up. Their daughter's first period. Way more often than you would hope, we have mothers bring their young daughters in with complaints of abdominal pain and blood in urine. Didn't you go through the exact same thing yourself at one point? A small fraction of people, including myself, randomly get a sharp pain when breathing in, typically on the left side of the chest. It's really scary at first, but it only lasts for a few seconds to a few minutes at most, and episodes can happen daily, weekly, or monthly. It's called precordial catch syndrome and is completely harmless aside from the few seconds of pain. Arriving on the scene, the guy says he thinks he is having a heart attack because his left arm is hurting. Vitals all looked great. He was sore from exercising at the gym. He actually said, "Yeah, but my left arm hurts worse than my right arm." To which the paramedic, basically my boss, was like, "Well, did you work your left arm more than your right at the gym?" Actually yeah. Well, that's probably why. Second day on the job. As we were leaving he was like, "Yeah, we get a lot of bullcrap like this. And half the time it's right when you're trying to eat dinner." Well, there was that one guy who found a bump on his wrist and called the ambulance, me, to ask if I had an x-ray machine in the back to check what it was. It was a perfectly normal wrist.